Get us up. There we go. Right on. Thank you, Brian. Welcome, everybody, to the Older Vermonters Caucus. Today, we're going to hear from Rosemary Green, who will be presenting about the AAAs. So thank you for being here. And I guess we could get started. Brian, are you going to be putting up the PowerPoint that she's put together?
Sure thing. I'll pull that up right now.
Fantastic. Thank you.
Thanks, Representative Noyes. First, I want to apologize for my lack of video. My internet's been going in and out, and I'm right now working on a mobile hotspot, so I'm hoping to conserve some bandwidth. So Brian's going to help me with the slide presentations. First, let me say thank you on behalf of V4A for the opportunity to address the caucus programs and services that the 5 AAAs provide to individuals 60 plus and younger disabled community members that are on the Choices for Care program. I'm Rosemary Green. I'm the Business Operations Director at the Southwestern Vermont Council on Aging. At this time, I'd like to take the opportunity for any other AAA director to introduce themselves if they're present. I see Meg.
I'm Meg Burmeister from the Northeast Kingdom Council on Aging.
And I'm Mark Boutwell, the new director at Senior Solutions Council on Aging for Southeastern Vermont.
I'm Tracy Schamberger, the Director of Business Development and Public Relations at AgeWell.
That might be it. So let me start by saying each area on Agency on Aging's objective is to help older Vermonters and younger disabled individuals remain in their homes and in their community for as long as possible, all while retaining a level of independence. Some of these individuals require a nursing home level of care. And given the high costs associated with nursing home placement, helping individuals remain in the community is cost effective. Now, before I jump into the presentation of who we are and the services that we provide, I'd like to just mention the impact that COVID-19 pandemic has had on our agencies and the clients we serve. COVID closures came fast. Our Meals on Wheels programs had to pivot almost overnight. Congregate settings shut down, offices were closed. And all while this was happening, our agencies continued to provide nutrition, case management, caregiving, transportation, volunteer, and elder care clinician services, just to name a few. We had clients who were scared and sometimes alone. Our Meals on Wheels program grew by almost 40% in a matter of days. I know at SVCOA, we usually would do about 30 Meals on Wheels intakes a month. Now we were doing 30 a day. I know other AAAs were also seeing the increase, some of them even to a greater extent. This was mostly due to the relaxing of federal guidelines. I just heard yesterday at our V4A board meeting that guidelines did not appear to be changing anytime soon to that program. So we expect the current volume to continue. We saw an increased need for volunteer services as well. At SVCOA, we began a new grocery shopping program because we saw the need. And I know that other agencies pivoted in how they provided services and looked at other ways to provide new services. Older Vermonters were scared to leave their homes. Case managers had to adapt to telephone visits instead of seeing their client face to face. Caregivers were overwhelmed because the adult day facilities were closing or had closed. Senior centers were closing, and home health agencies were at a capacity prior to the pandemic and now could not provide additional services for a variety of reasons. Workforce shortages, staff were out with COVID themselves. The caregiver crisis that was present pre-pandemic was now at a breaking point. I know the staff at the 5 AAAs were remarkable during this time. They were able to pivot almost overnight and provide continued care to those that are most vulnerable in their communities. We were so appreciative of the additional relief funding from CARES and Family First Acts. With the additional funding, we were able to meet the growing needs. It allowed us to pivot quickly and seamlessly and provide additional services to those that needed it most. So who are we? The Older Americans Act of 1965 identified a series of broad objectives aimed at improving the lives of older Americans. In 1972, the act was amended to create a national nutrition program and to authorize grants to public and nonprofit agencies for the development of congregate meal services for seniors. In 1973, the act was further amended to create a network of area agencies on aging, AAAs, which were given the responsibility for planning, coordinating, advocating local programs that would benefit older individuals. We currently have 5 agencies on aging. Age Well, which services Addison and Chittenden, Franklin, and Grand Isle counties. Northeast Kingdom Council on Aging, which services Caledonia, Essex, and Orleans counties. Central Vermont Council on Aging, which services Lamoille, Orange, Washington counties. The Southwestern Vermont Council on Aging, which services Bennington and Rutland counties. Senior Solutions, which services Windham, Windsor, and Windsor counties. Next slide, please. So who do we serve? ACL advocates across federal government for older adults, people with disabilities, and families and caregivers. Funds services and supports provided primarily by the AAA network in Vermont. They invest in training, education, research, and innovation. They manage a variety of programs authorized by several statutes, really strengthening the networks of the community-based organizations, funding research, and much more. The AAA network relies on our community partnerships and collaborations. We realized that we could not provide the level of service to older and younger disabled individuals without the collaboration of the many partners we work with and each day in our community. ACL's creation reminds us of these needs for these partnerships. Next slide. Funding and oversight. Each agency receives revenue from various funding sources, but most of our funding comes from the Older Americans Act and state general funds. Each agency receives their funding from a funding formula based on census data from the American Community Living Census Survey. We also receive awards from various grants. These revenue streams are not always sufficient to meet the community need, and we look to donations to fill the gap. Each agency is required to submit both area plans and budgets to Dale each year. We go through an approval process as well as periodic updates throughout the fiscal year. Each agency is also required to have annual audit, which also must be approved by Dale. We are required to complete the federal NAPIS reporting, which includes statistical data, financial data. So basically lots of oversight to us. Next slide, please. As we noted, ACL's advocates across all federal programs. And the Older Americans Act mandates that the area agency serve all persons 60 and older in their planning service area, regardless of income. The Act further stipulates that the area agency give priority service consideration to those individuals who are socially and economically in need. As we view the Older Americans Act mandates that guide our operations, we see the need to focus and direct our efforts towards developing and ensuring to the maximum extent feasible the availability of service to at-risk older individuals and disabled individuals in our service area. I know at SVCOA, we often see two overlapping groups in this at-risk category, those who are 75 and older and those with incomes at or near the poverty level. The over 75 group deserves special attention because of their increased frailty and the subsequent high incidence of health-related problems. The poverty group is an at-risk for a whole range of economic reasons related to just survival. I suspect that our sister agencies see similar concerns. Next slide, please. These are some of our community partners, and as you can see, a great many of them, and we rely on them each and every day to help us support our causes and supports and services. Next slide, please. Services and programs. Next slide, please. Thank you. The helpline. The helpline is often the initial point of contact for those interested in the agency's programs and services, whether it be for general question or an individual with a critical need. The helpline is a toll-free confidential service that provides older Vermonters, caregivers, and others with information, referrals, and assistance towards accessing local, state, and national resources and services. Helpline staff are certified by the Alliance of Information Systems, or AIRS, are there to listen and gather information, swiftly assess a situation or request, and ultimately provide accurate information or connect a caller with the appropriate AAA or external resource. Last year, our helpline staff fielded 26,663 calls. Next slide, please. One of the AAA's core offerings is the Case Management and Option Counseling Program. It brings together a range of skilled staff who specialize in working to give clients the support and opportunities to maintain or improve their independence and quality of life. Case managers are state certified. They work with and empower clients to make important life decisions around various services or supports, including long-term care services. Often regarded for their compassionate nature and ability to find solutions for clients, sometimes in very tight timeframes. We think of our case managers and option counselors as each agency's faces in the field in working one-on-one with clients. They are also adept at navigating the wide range of supportive programs that exist for clients of varying needs. As a result of their deep knowledge and person-centered approach, case managers and option counselors successfully serve thousands of clients each year. Last year in fiscal 20, they provided 59,972 hours of service to 7,203 clients. Next slide, please. Another pillar of service to older Vermonters and younger disabled individuals, which is administered by the Area Agency on Aging, is the nutrition program, aimed at filling community nutrition gaps and providing nutrition education and counseling throughout our service areas. Within this overarching program is the well-known National Meals on Wheels initiative. This program provides over 1 million meals each year to Vermont's older population, including both home-delivered and community-based meals. Not only do these meals play a vital role in supporting those who are most nutritionally insecure, they also provide a wide range of additional benefits that can be equally as important. With each home-delivered meal comes a general health and wellness check, as well as a social interaction that is valued by both meal recipient and Meals on Wheels volunteers. Our agencies successfully collaborated with meal providers to ensure that the hundreds of thousands of meals are delivered throughout the year in our state. In FY20, AAA supported the meal providers in providing 980,042 meals, home-delivered meals, to 7,725 individuals. Likewise, the program's congregate meals are offered regularly at over 100 easily accessible public sites across the state to help support the nutrition needs of older Vermonters, while also bringing them together in a communal setting where they can socialize, learn about other services, resources, and opportunities available to them, and ultimately remain active in their communities. Now, this was halted due to the pandemic, but hopefully will slowly be reopening as warmer weather continues. Now, last year, in fiscal year 20, 8,131 individuals were provided 109,953 congregate meals prior to the closing of sites due to the pandemic, which varied across our region from early March to end of March. In addition to home-delivered and congregate meals, each AAA has a registered dietitian who provides personalized nutrition counseling to hundreds of older Vermonters annually, as well as general nutrition presentations to various community groups. Each dietitian reviews the menus for nutrition services to ensure compliance with federal guidelines. Next slide, please. Caregiving can both be rewarding and stressful. Our agencies offer a wide range of services and supports for the caregiver, including the Dementia Respite Grant Program, National Family Caregiver Support Grants, and a variety of caregiver educational opportunities. Powerful Tools for Caregivers is an evidence-based and nationally recognized program that offers tools and resources to help caregivers take care of themselves while caring for a family member or friend, and is offered at several of our agencies. The Elder Care Clinician Program is a collaboration between designated mental health agencies and the Area Agencies on Aging. This program offers a wide range of mental and emotional health services to Vermonters age 60 and older who are primarily homebound and would have difficulty accessing office-based care. Additionally, elder care clinicians may provide support to caregivers of those dealing with mental health issues so that they have the tools to manage their own challenges and stress. Next slide, please. Understanding today's health insurance landscape can often be challenging, but our state health insurance program, or SHIP, is here to help. SHIP coordinators offer free, confidential health insurance counseling to current or potential Medicare beneficiaries. The trained, certified, and skilled SHIP staff at each agency is committed to educating, advocating for, and encouraging individuals and their families to make informed healthcare benefit decisions. They also provide new to Medicare presentations at various sites throughout our state each. Next slide, please. Working in a collaboration with a number of community transportation providers throughout Vermont, the AAA network helps to ensure that older Vermonters are able to get where they need to go when they need to get there, whether for regular daily errands, important appointments, or to visit family and friends. Our agencies believe mobility through easily accessible public transportation is critical to older Vermonters maintaining their independence and quality of life. As a result, each agency provides transportation options with coordination with our community partners, as well as ride coordination to eligible older Vermonters. In fiscal year 20, our agencies helped to support 65,599 one-way rides to older Vermonters and younger disabled individuals. Next slide, please. Central to several of our programs and services that each of our agencies offer are the many dedicated volunteers and senior companions. Coming from a wide range of backgrounds, our volunteers and senior companions have one thing in common. They are all committed to helping older Vermonters lead healthy, happy, and productive lives in the setting of their choice. Our agencies rely on a team of hardworking and knowledgeable volunteers to help with a wide variety of tasks, all which work to support older Vermonters in our service area. Although unpaid, our volunteers are invaluable to the agencies and, more importantly, to those that they serve. Next slide, please. Agency wellness programs are based around the fundamental goal of promoting overall physical and mental health among older Vermonters in our state. Each agency collaborates with area partners to offer wellness programs to older Vermonters. One initiative is the Tai Chi for Falls Prevention, a series of nationally recognized and evidence-based classes aimed at improving the balance, strength, and general health of older individuals. Many other programs are also offered, such as Pearls, a program designed to assist older adults and adults living with a disability who are also experiencing minor or major depression. Agencies regularly attend or host wellness-focused fairs and educational presentations and referrals to key community resources that offer programming specifically for older Vermonters. Our agencies believe in empowering and supporting individuals to remain energized and active in their communities, both physically and mentally, and our wellness programs assist with that process. And now, although there's not a slide enclosed for outreach, you've heard me mention presentations and outreach at various times in the nutrition and wellness programs. But each AAA also provides outreach efforts in their own service areas to town offices, libraries, churches, just to name a few throughout the year. They offer the services that our agencies may provide. Our goal is to make available information on a variety of topics that are of value to older Vermonters and caregivers. In addition to those in-person or virtual presentations, our agencies also write articles and provide information through social and media outlets. That concludes my presentation. Lots of information in a quick period of time.
Great, thank you. Thanks. So are there any questions or comments? Trying to make sure I can see everybody here. All right.
I have a quick question,
Yeah,
Dan.
go ahead, Teresa.
So I received a question from, this is a person in Chittenden County with regard to specifically around services in the Choices for Care program and not being able to access case management services either from the area agency or the home health agency. And I guess I was just wondering, I know that there are workforce issues all across the board. And I was just wondering if with particular regard to the AAAs, if you were having any issues in terms of filling positions for case managers, service coordinators, you know, in that role.
So I can't speak for Chittenden County. I do know that as SBCOA, we have had difficulty filling positions for case managers. Certainly during the pandemic, it has been challenging. Not not just in the interviewing process, but in having people apply. I think people have either just really stayed where they are and have not wanted to venture out. So I would say for us, it has been a challenge, but I can't speak to Chittenden County.
I can speak for the Northeast Kingdom, and we've not had a problem with that. We've been able to hire people and are kind of proud of the fact that we could bring staff on during a pandemic, orient them through working with them through Zoom and do so remotely and get people up and running. So we've been able to do that.
Thank you. I was just wondering that, yeah, okay, I see. Person from AgeWell's unmuted herself.
Yes, sorry, I also have my video off. We also, like Meg, have not had problems recruiting new caregivers. We've brought several new staff on. And we've done quite a bit of new staff development using, obviously, technology to get people trained so that we limit our contact. But it has not been a problem, and we've in fact increased our New American caregiver support as well. So,
Okay, thank you, thank you. And I guess the one follow-up I'd like to have for that is I'm curious because this person didn't know about flexible choices or, you know, the opportunity to manage their own services. And that's generally a role I think of, at least for a service coordinator, in terms of, you know, explaining what the options are for the person. I'm just wondering if that's something that's, you know, in general, when you're talking with folks, if that's something, if they are having problems, you know, getting their attendance services or whatever it is that they might have, is that something that you talk with folks about?
Definitely, we are actively involved in that. And the other, you know, point you touched on is sometimes people are connected in the flexible arena where they're able to self-direct all of their own services. And sometimes that gets a little tricky for people who are thinking that they're comfortable navigating that system and then finding that it's a little more challenging. But in addition to the area agencies on aging, the long-term care clinical care coordinators, the LTCCCs, or the nurses from the state of Vermont, also do an educational component around all of those topics when they do a clinical assessment.
Okay, thank you.
Chip, you have a question?
I just wanted to know if it's been a while since I've been to our local AAA to see you, Meg. But I was wondering if we could get or you could distribute a copy of that slide presentation. The statewide numbers are fantastic, and I'd like to try and have that in my file. Is that a possibility, Rosemary?
Absolutely.
Yeah, and I'll include it with next week's, with the minutes and the announcement, so it'll be attached to that. Okay, great. Thanks, Dan. Hey, I would like to hear more about caregiver support for new Americans. I heard that mentioned, and maybe you could just elaborate on that a little bit. It's
well, we have at AgeWell a whole dedicated team for new Americans. Our primary new American population are Bhutanese, but we obviously are working very closely with other stakeholders and community partners that have much more diverse populations than just Bhutanese. It just so happens a large percentage of the programs that we run for older new Americans are with the Nepali and Bhutanese population. So we run programs in conjunction with the Winooski Senior Center. Obviously, many of those were not in person during COVID, but we were able to continue maintaining contact with those people through the distribution, through the funding through Dale for tablets. I can't remember. Meg, you may have also gotten this. Is it it was a Dale grant, and I always forget
It's
the acronym.
It's ADRC.
ADRC. I don't know why.
Aging and Disability Resource Connection.
Okay. Well, we were very successful with that program, particularly with our new American population. And in terms of caregiver support, we run a lot of training, remote training that we were able to offer to our new American population, because many of those are people that are living in the homes and they're caregivers for their families. And so any support that we could offer around caregiver support and respite support in terms of helping that group of people, we were able to do using our tablets, which was incredibly effective. I think we distributed 130 tablets and then offered training.
Thank you.
You're welcome.
Must be pretty challenging dealing with that, especially during COVID. So I think that's definitely some work that you put into that program for sure. Does anybody else have any questions or comments or other things that we're looking to talk about today? Okay.
I just wanted to say, Rosemary, you did an incredible job. It's really hard to take such a huge body of work and to cull it down and be so succinct. So I really appreciated it. It helped me, and I'm getting some great ideas from it. So thank you.
You're welcome. Thank you for the compliment.
I also wanted to mention, just encourage, I guess, folks in the AAA community to, and anybody else on the meeting, to reach out to the Senate Health and Welfare Committee on H-153, which is the bill to have a path forward with regard to cost of living increases for home and community-based providers. It's important for them to hear from the community about the importance of this bill. And so I would really encourage people to reach out to members of that committee to, share their support and interest for the Senate Health and Welfare Committee to take that bill up for further discussion and action. That would be immensely helpful.
Yeah, thanks for bringing that up.
We are working on that.
All right.
Okay.
We're right down to, a month or so left. So, hoping to see some action on that in the Senate for sure. So yeah, anybody who has, if they work with constituents of the members of that committee, would be very helpful to have them reach out and talk about their interest in seeing that move this session for sure. Great. All right. So without any more questions, if anyone has any other topics they want to bring up this afternoon or things they want to talk about. Okay. Next week we have we have nutrition programs. So we'll be talking about our nutrition programs here in Vermont next week, and then I think we're gonna try to get some topic around the hearing aid bill. That's been hearing quite a bit about that in my constituents reaching out to me. So hopefully we can hear what's going on with that bill. It's in the healthcare committee in the House, and maybe we'll see at least some testimony this year. I don't know if it's on for this week. I didn't check their agenda.
No, but it might be helpful, Dan, if we reached out to the one of the members of the leadership there to see if they might be willing to come speak at the Older Vermonters Caucus. Yeah,
absolutely. And I know that Cove has been working on that as well. So yeah, good. My dad actually called me about that. He's like, I need new hearing aids. How do I get them? All right, very cool. All right, well, thank you everybody for coming today. Appreciate it. Looks like we're gonna wrap up a little early and get outside and enjoy some sunshine. So thank you everybody.
Thank you, everyone.
Thank you.
Thank you.
Bye.